Good morning to all of you. Myself, Dr. Pratima Koshewara. I'm Assistant Professor in GMCH Mahasaman. Today I'm going to present the clinicopathological profile of perimenopausal abnormal uterine bleeding, a retrospective case series studies. AUB is a common gynecological concern in a woman during the perimenopausal stage. The menopausal transition involves the hormone fluctuations and higher incidence of structural uterine abnormalities. According to the NICE guidelines, AUB is defined as significant amount of the bleeding which impairs the quality of the life, productivity, and the mental health of the patient, an essential part of evaluation in ruling out the endometrial hyperplasia and cancer. Perimenopausal AUB is a heterogeneous clinical condition. Histopathological examination always remains the golden standard for evaluating the endometrium. Data from the central India are limited. Gaining insight in clinicopathological profile would facilitate early diagnosis and appropriate management. Objective of my study is to evaluate the clinicopathological profile of perimenopausal women presenting with AUB. It is a retrospective descriptive case series conducted in a 9 months duration from the August 2025 to the May 2026 in the Department of GMCH Mahasamun with 47 consecutive perimenopausal women with age range of 40 to 55 years age group. This is how I have screened. According to my data, 80 patients were eligible. Out of that, the 26 patients got excluded with the age of less than that of the 40 years or more than that of the 55 years or having the postmenopausal bleeding or any type of the vaginal or cervical pathology, out of which I have excluded the 54, out of which some don't have a data completed. In one patient, the USG is missing, out of which finally I have concluded the 47 patients who have all the statistics. Then results of my studies according to the distribution of age. The most of my study participants belongs to 45 to 49 years of the age group, that is accounting from 60% of the population. The presenting symptoms was the most common was the heavy menstrual bleeding in 40% of the patient, followed by the polymenorrhea, menometrorrhagia, intermenstrual bleeding, and the others. Then, according to the duration, most of the patients come within the 6 months of the duration, that is 68% of the patient, followed by 6 to 12 months in 27% of the patient, and those patients who have visited many other consultants in the GPs, they have a persistent symptoms of 12 months also. Then, according to the parity, most were multiparas, having the para 4 is the most common, followed by para 3 and the nulliparas. Then, according to the presenting symptoms, they have 46% of the patients were normal, having no anemia, and 17% having the mild anemia, 32% having the moderate anemia, and severe anemia in 4.3% of the patients. Then, according to the ultrasound reports, fibroid uterus was the most common in 27% of the patient, followed by thickened endometrium, endometrial polyp, adenomyosis, others, and normal study. Then, according to the histopathological spectrum, proliferative endometrium was the most common, indicating that the anovulatory AUB is the most common cause, followed by the endometrial hyperplasia, simple hyperplasia, secretory endometrium, others, and the disordered proliferative endometrium. Then, according to the management patterns, 34% of the patients underwent hysterectomy, where 30% are on the ongoing medical therapy, 21% got benefit with DNC, and 14% got benefit with Marina. Then, according to the outcome, 85% of the patients have got symptomatically improved, out of which 34% have a hysterectomy. Out of the medical management, 51% of the patients have the symptomatic improvement, and those who are having the persistent symptoms were 8.3, and those who are lost to the follow-up were 6.4%. Then key findings are the anemia is present in 53% of the patient. Heavy menstrual bleeding was the most common presenting symptoms. Uterine fibroid was the most common ultrasonographic finding, and endometrial hyperplasia was most common. Hysterectomies have been achieved in 34% of the patient, and overall clinical improvement is achieved in 85% of the patient. Then discussion. Perimenopausal AUB is most commonly observed in 45 to 49 years of the age. Hormonal fluctuations during the menopausal transition. This is conducted in 2025. Heavy menstrual bleeding was a predominant presentation, while the anemia affect more than half of the patient, indicating substantial clinical burden to the our society. And fibroid uterus emerged as the most common structural abnormality, supporting the significant contribution of the Perimenopausal classification and related causes in perimenopausal AUB. Endometrial hyperplasia was identified in 1/4 of the cases, emphasizing the importance of routine endometrial evaluation for early detection of premalignant lesions in the perimenopausal patients. Favorable outcomes in the majority of the patient underscore the effectiveness of structured diagnosed approach incorporating the ultrasonography and histopathological assessment. Take home message is perimenopausal abnormal uterine bleeding should not be regarded merely as a manifestation of menopausal transition. Rather, it warrants the systemic evaluation to identify significant underlying pathology and guide timely intervention. Thank you.
In your study, I think it appears that all cases of fibroid were operated.
Ma'am, those who are having the large fibroid, we have operated. And those who are having the small fibroid near around the 55, we give the fibrois mifepristone for their management
So
also.
34% had hysterectomy, right?
Yes,
And
ma'am.
the rest were managed medically.
Medically.
Only 7% with LNG-IUS.
Yes, ma'am.
So what medical management was given to the
Ma'am,
rest?
we have got norethistron, medroxyprogesterone, and we give ormelofexin also, mifepristone,
Was used.
and ocipils.
Actually, regarding your classification, the terms like menorrhagia, menometrorrhagia, these nomenclatures are no longer used.
Yes,
so
ma'am.
whenever you
They
are
are replaced by
so
AUBO.
you have written your classification heavy menstrual bleeding and menorrhagia. Is there any difference between heavy menstrual bleeding and menorrhagia? So your classification would have been like as per the Palm-Coin classification. It would not be like that you are writing heavy menstrual bleeding and other cause is menorrhagia. Is there any difference between heavy? That is one point. That is menorrhagia, menometrorrhagia. These nomenclatures are no longer we are using.
Yes, ma'am.
Well, so that is polymenorrhagia also. This nomenclature now is obsolete. Second point I am telling about regarding the treatment. So you have done DNC in only 10%, 10 cases. Actually, for any woman who having bleeding up to 40 years, all women should have undergone DNC in a primary treatment. Then only you can certify that what is the pathological. Then you will think medical management or management.
No, ma'am, it's not like that. We have done DNC in almost 57% of the patients. Ma'am, it is on the slide.
No,
Those who are having benefited by DNC is 17%.
Actually, would have been done DNC in every patient.
At least an endometrial biopsy.
Yes, ma'am, endometrial
Every patient.
biopsy.
Then
Standard.
you will classify whether I'll go for the medical management or I'll go for the Mirena or I'll go for the hysterectomy. All these things that would have been there.
You are an assistant professor, so terminology plays a very important role. You know,
Okay.
the recent stud which has come recent.
No
It is
longer we are
totally-
using 2021 we go we no longer
And-
using menorrhagia or metrorrhagia, DV, all these things are now obsolete.
Anyway, participation is a great thing. Okay.
Thank you.